Welcome to the monthly Editor's Summary podcast presented by JAMA Health Forum. I'm Dr. John Ayanian, the director of the Institute for Healthcare Policy and Innovation at the University of Michigan and the editor of JAMA Health Forum.
And I'm Dr. Melinda Buntin, Bloomberg Distinguished Professor of Health Policy and Economics at Johns Hopkins University and the deputy editor of JAMA Health Forum.
JAMA Health Forum is a peer-reviewed, open-access online journal focused on health policy, healthcare systems, and population health, and one of 12 specialty journals in the JAMA network. Our podcast each month presents highlights of new content from the journal, including timely interviews with authors of research studies and commentaries. Follow us on jamahealthforum.com, on Apple Podcasts, or wherever you get your multimedia, and on jamanetworkaudio.com.
Today, we're discussing highlights of the Academy Health annual research meeting that's just finishing up in Baltimore. We're recording this episode on July 2nd, the final day of the conference. And in particular, we'll feature key findings from 4 highly rated abstracts presented at the meeting that were published concurrently as original investigations in JAMA Health Forum. Last year, Academy Health designated JAMA Health Forum as one of its 4 official journals, and this is the second year that JAMA Health Forum has offered the opportunity for rapid review and publication to authors of the most highly rated abstracts at Academy Health. But first, we'll be speaking with Dr. Aaron Carroll, the new president and CEO of Academy Health, to learn about his insights from his first annual research meeting as CEO and his vision for the organization going forward.
Thanks, Melinda. Our guest, Dr. Aaron Carroll, became the president and CEO of Academy Health in March 2024, succeeding Dr. Lisa Simpson in this role. He previously served as Distinguished Professor of Pediatrics and Chief Health Officer at Indiana University. He also serves in the JAMA network as the web and social media editor for JAMA Pediatrics. Welcome, Aaron.
Thanks so much for having me.
So, Aaron, how have your early months been as the new leader of Academy Health?
Well, the first few months have been an absolute joy. As Lisa Simpson, the previous president, would have said, the first few months are somewhat like drinking from a fire hose. It's meeting a huge number of our external partners, some of our funders, many of the organizations we work with, and also spending a significant amount of time learning about all of the things Academy Health does. I don't think that anyone outside the organization could actually appreciate how many moving parts there are. About half of our revenue comes from extramural funding. We're involved in all kinds of research. In addition to having 2,600 or so members, in addition to all the organizational members, and putting on a couple huge meetings each year. And of course, we were just at the annual research meeting, the flagship meeting of Academy Health. I hope it was a phenomenal success. From my perspective, it certainly was. We had a huge turnout. I think we had over 2,900 registered attendees, which surpassed even the number that came to last year's meeting in Seattle. People seemed really energized, really interested in being there. I like to think that this is one of those meetings that people want to come to, not have to come to. And you can really feel the excitement, the energy, and the networking throughout the conference. And it's been an amazing few days.
Thanks, Aaron. Melinda and I were both at the meeting and experienced that energy that you're describing. What were some of your takeaways from the meeting and the plenary sessions or other sessions that you attended and some of the conversations you may have had with members?
Well, the plenary sessions were spectacular. The opening plenary was a discussion about a national public health infrastructure. I thought that was fantastic. The next plenary was focused on how to push your research forward, even in polarized times. And it was amazing. It was just full of insights, and I heard nothing but excitement from people who attended that. The final plenary was also really great. We heard from Dr. Betancourt, who is vice president at Sesame Workshop, about translating important research for the community and involving the community in research from a Sesame Street perspective. I know that for those who were able to stick around to the end and really heard that, it was well received. And then I was going to do an Ask Aaron session to answer questions of attendees of things they might want to know about Academy Health. But if you were here, fire alarm went off and cut the meeting short. So we all ended a bit early, but I'm sure everyone was happy to get back on the road. But in general, I think also the meeting is really great because so many opportunities exist to network, to meet people who are really engaged in the field for a long time or people who are just new to the field. And it's those connections and the relationships that begin and then continue outside the meeting that really make ARM special.
Melinda and I have experienced that networking and strength of connections over many years as members ourselves of Academy Health. Aaron, as you pivot and move forward from the annual research meeting, what do you see as the most important opportunities and challenges for Academy Health and its members and staff going forward?
Well, as I talked about in Saturday's opening plenary, one of the things I think we really need to focus on is science communication. Health services research has not done a great job of even getting people to know what it is, let alone why it's important and why more of it might be necessary. I also think that coupled with that, and perhaps related, is that the field is too good at pointing out problems and needs to shift towards focusing on solutions. That alone would probably help us to do a bit more with science communication. I think it's important that we continue our work on DEI, but again, focus on our strengths about producing and bringing evidence to bear to improve health and health policy. It's also important with our DEI work that we focus again on solutions, not just pointing out problems, which has been too much of a focus in the past. A lot of our state-based work, which has been very successful, we need to double down and lean into that. It's very hard to get things done at a federal level, but more action is often happening at a local level, where not only is it easier to get things done, but that's where the actual action happens. And so I would like to see more of that. And of course, we'd be remiss if we didn't acknowledge the looming importance of both more data and, of course, artificial intelligence. We need to incorporate these tools more seamlessly into health services research and also bring our methodology to bear in order to make sure that as these tools are starting to be deployed in healthcare and the promotion of health, that we make sure that benefits always outweigh harms and that we take an accurate assessment of both.
How do you think JAMA Health Forum and maybe the other 3 official journals can help to partner with you to advance the field and perhaps to disseminate information better and disseminate solutions effectively?
First of all, I love the fact that you did expedited review for some of the top abstracts, because I think trying to bring important research to the field as quickly as possible is, of course, very important. I'd also say that we could all do a better job of working together to try to promote and get good research out to the general public where it might be absorbed in a way that they might take better. And of course, there's room for improvement for all of us with that. I think the use of podcasts like we're doing right now, in addition perhaps video, and trying to publish summaries or things that might translate the research for the general public in ways that they might absorb better than the usual publication methods, which just are each of us speaking to each other, is valuable. I also think that trying to find ways to encourage research that focuses on solutions and encourage the promotion of such research is something that is in journals' hands, and as much as we can do to foster that, so much the better.
Thanks, Aaron. During our podcast interviews, we like to ask a couple questions of our guests, and I'll pose the first one to you. What's the best advice you've been given about your career and how it has shaped your career path?
When I was starting out, a lot of scientists gave me the advice that you should focus your niche as small as possible and make yourself an expert in something different from everyone else. But then I had one mentor who said something slightly different. He encouraged me to, and I will remember this forever, order off the menu. He told me that when you finish medical school and you go off, you're handed a menu and you're offered a few specialties to choose from, and you pick what's best. It's all, there's not much menu options. When you get to residency, you're given page 2 of the menu, which is all the subspecialties and things that you could choose from, and most people do. But he encouraged me to say, to question that, in a way, ask the chef if I could have something that I would like. And I chose a career that was very different than most of my compatriots in residency. I went into health services research. I wanted to help improve the healthcare system. And then I think I continued to try to order off the menu. I got interested in mentoring severely, and I really focused on how do we build programs within IU School of Medicine and later Indiana University to improve mentorship. I got really interested in science communication, and I started a blog, and I started a YouTube channel, and I wound up writing for a variety of major media. And later, when the pandemic came, I really was tapped to help run that, and then I became Chief Health Officer, which was a job that hadn't even existed before, to try to help lead IU's pandemic response and then other health initiatives. But in all of those, I kept trying to expand my skill set, but also accept that there wasn't going to be one thing that I was going to do. I was going to keep trying to do new things. And some of those things would be things that people hadn't done before. And that's absolutely made all the difference in my career.
Thanks for that answer, Aaron. That is a prime example of why we ask these two questions of all of our podcast guests. And that was a really thoughtful and thought-provoking answer. So our second question is, what's the biggest change you expect over the next 5 years related to health policy?
Ooh, with related to health policy. Partially, I think that's going to depend on how the election goes in November. Because obviously that could change how broad health policy goes. But if I was to pick anything, I think there will probably be a growing understanding that more action happens at a local level than I think at a federal level. Because regardless of who wins the election in November, there's a significant amount of gridlock in the ability to pass major legislation at a federal level. But lots of policy changes happen at a local level. And I think that there's much more room for enacting change and trying new policy at a state, city, or even more local level than ever before. There were a number of Academy Health sessions that focused on that. And as we continue to try to push that narrative, people may become more engaged and perhaps develop new skills in trying to talk to people who may disagree with them, but still try to find common ground and get things done. And that is what gives me optimism, regardless of what happens this year.
Well, thanks, Aaron. That sounds like a nice recap of the second plenary you were mentioning as well.
I would agree. No matter what, I do want to convey that sense of optimism. I think that this is really a significant time when not just health services researchers, but health policy researchers in general can try to work with people from, all walks of life, but trying to find again that common ground where we all want to take data and evidence and use it to improve health and healthcare. We have to get past the idea that we're trying to win and instead focus on there are ways we can agree on to improve health and healthcare for all. And that's Academy Health's mission.
Well, thank you again, Aaron. Now we'll turn to the featured research published concurrently with the meeting. John, can you start off by telling our listeners about the key findings of the first of the 4 studies published in JAMA Health Forum during the Academy Health Conference?
Yes, Melinda. In this study by Stephen Mine and colleagues, the authors used the National Health Interview Survey to evaluate changes in healthcare affordability across income groups during the COVID-19 pandemic. They found low-income adults in 2021 and 2022 were less likely to delay or avoid seeking care due to cost than before the pandemic, and the disparities in these measures across income groups were substantially reduced.
Those findings are somewhat surprising given economic hardships of the pandemic, particularly for lower-income Americans. What explained this narrowing of disparities in healthcare affordability during the pandemic?
So the study didn't address the question directly, but the authors suggested that pandemic-era federal policies, including direct income support, expanded premium subsidies for ACA market plans, and maintenance of Medicaid coverage, may have improved healthcare affordability for low-income adults. So, Melinda, what did the second study published during Academy Health show?
So the second study was by Adriana McIntyre and colleagues, and they analyzed a household survey of low-income adults enrolled in Medicaid in 4 southern states in order to assess how Medicaid beneficiaries were affected by the, quote, unwinding of Medicaid coverage that began in the spring of 2023. About 1 in 8 Medicaid beneficiaries in this survey reported losing Medicaid coverage, and half of the group became uninsured. Those adults were twice as likely to report cost-related delays in care relative to those who retained Medicaid coverage. Next, shifting gears from Medicaid to Medicare, John, tell us about the focus of the third study.
So this study by Callie Koukounis and colleagues evaluated a new CMS demonstration project called the ESRD Treatment Choices Model. Beginning in 2021, CMS randomly selected 30% of hospital referral regions across the U.S. for dialysis facilities to receive financial incentives to encourage greater use of home dialysis and kidney transplants for Medicare beneficiaries with end-stage renal disease. In the first 2 years of the new model, this study found rates of home dialysis and kidney transplants did not differ between intervention and control regions. So it will be important to follow these outcomes over the remaining 4 years of the ESRD Treatment Choices model. Melinda, what was the focus of the fourth study presented at Academy Health that we published in JAMA Health Forum?
So in this study, Jody Liu and colleagues used a microsimulation model to project changes in healthcare spending and insurance coverage under 3 potential policies: rate setting, annual spending growth targets, and a single payer system. They noted that U.S. households currently devote about 1/4 of their total compensation to healthcare, and they estimated changes in these payments and coverage across income groups with each of these 3 policies in 2030. I'd urge you to check it out for the details. And I'd also like to note that this study is a great example of the type of simulation modeling study we've been publishing in JAMA Health Forum.
Thanks, Melinda. That wraps up highlights of the 4 studies from the Academy Health Annual Research Meeting that were published concurrently in JAMA Health Forum. And we expect other top studies from the meeting will be published in the journal during the months ahead. Thanks again to our guest, Dr. Aaron Carroll, the President and CEO of Academy Health, and to the authors of the 4 featured studies that we've discussed in this podcast. This episode was produced by Daniel Musisi at the JAMA Network. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com or search for JAMA Network wherever you get your podcasts. Thanks for listening.